Dr. Amy Patdu from Manila is using Tixel for over a year. Thank you for this interview. Please tell us about your experience with Tixel.
I'm using Tixel for treatment of deep wrinkles, acne scars, for skin rejuvenation, and for refining of pores.
And which body areas do you treat?
First, the face. When I'm doing the face, I'm also doing the entire periorbital area. The neck, and then up to here, the décolleté, and the hands also.
Is treatment painful?
No, it's not.
How many treatments are needed?
6 sessions for each of my patients, and it's done at a 2-month interval.
How long does treatment take?
The entire treatment, you mean 15 minutes.
And how soon do patients see results?
For the first few weeks, 2 weeks, they will see the change in the epidermal layer of the skin. You will see it as glowing. And then after a month, you will really see the changes in the tightening. You will see the tightening effect of the skin, especially the neck areas. But I notice when I'm doing the eyes, the periorbital area, in 2 weeks, you will see already the change. You will see the lifting of the lids.
And how long do results last?
For 1.5 years now, I've been using the Tixel. So with my patients, it really gives me a very good result. The program is 1 year for my patients. Then they come back after a quarter. Wow, they are very, very young now as compared to their first photo with us. And they are very happy.
What about post-treatment care?
We are just advising the patients to really moisturize their skin. Any good moisturizer will do. And of course, sunblock. A sun protection is a must.
Can you please summarize the advantages of the new technology for the patients?
With the Tixel technology, I can actually perform a lot of things. Number 1, if my patient is really wrinkled, I am increasing the parameter of the Tixel because I'm targeting deeper lines. And eventually, the skin will really tighten. And then, I can sometimes decrease the parameter of Tixel and just improve the texture. So it's like for them having the regular chemical peel, but instead of a chemical peel, they are having a Tixel, which is far, far, far better than the chemical peel, especially among Asian skins, because it's not irritating their skin. So it's really good. The capability of the Tixel is wow.
Can you use it on delicate skin, thin skin?
Yes, you can. Just change the parameters.
Nice. Can you treat the eyelids?
Yes, I'm treating the entire lid, and this is the only device in which you can perform the treatment on the entire thing, okay, without causing harm to the eyeball.
Tixel employs a titanium tip which is always sterile. Is this important?
It's very, very important. I've used an RF technology before, microneedling. We throw the needles immediately. With the Tixel, the titanium self-cleaning, and at 400 degrees centigrade, no bacteria.
How does Tixel treatment help improve active acne?
We tried it with patients with really active cystic scar. Most patients with acne, severe acne, you will notice that their face is also very red. When you are doing the facial, you will feel that, the bumps inside because of the cystic acne. I did perform a treatment using the Tixel. On the first week, it dried up the acne. And then you will see gradual reduction on the redness of the face. And then after a month, if you will touch the skin of the patient, you will notice that it's starting to get even, the surface. For most patients who are suffering acne, they also have very large pores and of course areas affected by the scarring. So you will also see it's improving, gradually improving. It's becoming shallower.
Do you have any tips for the doctors?
You can achieve 2 things with Tixel. For a simple rejuvenation, which is like equivalent to a medium depth peel, just to brighten the epidermal layer of the skin. You achieve that in 2 weeks. But because of the capability of the Tixel, you're like hitting two birds in one stone, right? You're not only improving the upper layer of the skin, and in the long run, say after a month, you will see the tightening effect also. The changes here, you will notice that the face is more contoured because it's tightening. And then the neck, wow, Tixel is like magic with the neck. See, 90% of my patients are Asians, and Asians are very delicate. Especially in the Philippines, we are a combination, really. We are brown, and say 40% are a mixture of Chinese Filipino. So it's like yellow or whiter in tone, but still very sensitive. So when you're performing the Tixel treatment, you have to set certain parameters. There's a limit, not very high, because the skin is very delicate.
Are there any visible signs of crust after treatment?
With the new titanium tip, it's very, very minimal. Super minimal. Okay? Even if you do the double pass, still almost none, except on the cheek areas.
Do you do double pass?
For really wrinkled skin,
And it helps?
yes.
Do patients stay home after treatment?
Asians are quite conscious with the scabs. Even though it's not very noticeable, they rather stay at home. The older ladies, but the younger generation, if I'm doing Tixel, they don't mind if they attend a party and then you see minimal scabbing there. They just apply makeup. It's okay to apply makeup after.
So the younger ones don't stay home at all?
Yeah, but the older generations, they will not, of course.
They will stay home how long?
For 1 or 2 days.
Did you have any complications on any of your patients?
None, but you need to remind them not to forcibly scrub, especially in the neck area. Especially when it's healing. When there's a scab formation, some patients are very conscious of it and they would want to accelerate removal of the scab, which should not happen. You have to remind them, especially the Asians, don't forcibly remove the scab. Since it's drying up, some will experience some sort of itching. Just apply the moisturizer and then the itching will disappear.
Do you normally perform a full treatment?
Face and neck, including the periorbital area.
That's the typical routine.
Typical.
And why do you wait 2 months between treatment instead of just 1 month like on Caucasian skin?
For one, I think the skin, I see my patient's skin are super sensitive, and it's good for them to appreciate the result much longer, because in the first 2 months they really see the gradual changes. If you immediately do the treatment, it's kind of not appreciated. You want them to really go for the treatment because they see that their skin is really changing. Their appearance is really changing.
When do they start to see a change in their appearance?
As I told you, the first one that you need to observe is the periorbital area. I don't know why, maybe the skin is very, very thin in the periorbital area. That's why in just a week or 2, you will see the changes in the lagging of the skin. So make sure you take a photo and compare it. And then from there, your patient will really, really appreciate the changes that is being brought to you by Tixel.
Is Tixel used also on men?
Yes, but I increase the parameter. I double pass if it is with acne scar.
If you compare this to other technologies, what is the news about Tixel for the patients?
I have patients who I did treatment of RF microneedling before. That's why I can compare the fractional result of the Tixel. One, it was very, very painful. So the inconvenience with my patient is sometimes it's bleeding. It's very swollen for the next 24 hours until 2 days. The result, you get much better result with the Tixel. as compared to the RF microneedling that I had.
So you see tightening with Tixel
Yes.
in which areas predominantly?
Here, because that's the most obvious laxity in the face. Here, and then the neck.
What about treating the upper lip?
Yeah.
Smokers, for example?
Yeah, the lines. You will see it's becoming shallower, and then the lines gradually disappear. The same as the crow fits in the forehead.
How is the forehead responding to Tixel?
No more Botox because the lines are gradually disappearing.
Were you able to get skin depigmentation? or-
Actually, Tixel alone will break the pigmentation, even with the pigmentation caused by acne. But you need to tell them, you need to be very patient. Okay? Not one Tixel treatment will immediately remove all those pigments created by the acne. It takes time.
Dr. Amy Patdu, thank you for this interview.